Hello, my dear future nursing officers. Welcome you all to the Master Nursing classes. In the today's video, we are going to discuss again the most important questions. As in the last video, we have discussed a very high yield and important questions on the chest tube drainage and clinical questions on the chest tube drainage system and updated things to insert the needle decompression site. And after that, we have discussed the most important questions on the Sengastecken Blackmore tube, Minnesota tube, and Linton tube. Most importantly, we have seen the difference and clinical questions where why we have to keep the Caesar at the bedside. Okay, how we have to identify the compression of the airway in the Sengastecken Blackmore tube. Okay, so everything that is important related to the exams on the questions from the chest tube drainage and Sengastecken Blackmore tube and related to the TIPS procedure. That is the transjugular intrahepatic stent also we have seen in the yesterday's class, and only two oxygen delivery system, that is the simple face mask and Venturi mask, the golden point chanting and revision we have done in the yesterday's session, which is most important for your upcoming exams. Very warm welcome once again to everyone to Master Nursing classes. Very warm welcome to everyone. Yes, all are live to the session, so please do hit the like button. And if anyone is watching the Master Nursing classes first time, if you found the previous content is helpful, and if you are watching a first time, so please do subscribe to the channel. Okay, your one particular subscription also matters us a lot, right? Yes. So all are live to the session. So please do hit the like button, and we will continue the today's class with a very beautiful motivational quote. Okay, students, we have left only few days for our Norcet 8 prelims exams, and many of you are sending a message, sir, I am not unable to study because of this stress and everything. So one clear message from my side: this is the normal thing which is happening to every aspirant, the anxiety, the fear. Okay, so that is the apprehension which is completely normal for our aspirants. Okay, so yes, you people have to feel that perfectly. Okay, so don't think much, go with a thing which is there with you. So revise the notes which is already you people have made. Okay, so many new thing will come in front of you people, where you people will feel that I have not studied this one, I have not covered that one, I have not covered, like, so it will happens to everyone, not only you. Okay, so nursing is a vast syllabus, you never ever cover the 100% syllabus. Yes, you can cover maximum 75 to 85% of syllabus, so that is more than enough for cracking your Norcet exams, right? So don't think much, don't compare yourself with others. Yes, okay, so try to move on with the thing what you have in your hand. Okay, so work hard and dream big and never give up. Okay, never ever give up until the last minute of your preparation, right? So keep working hard, keep preparing yourself, keep updating yourself, and remember this word: never give up. Okay, you are having that potentiality that you can crack the exam definitely. The analytics, the thinking capacity, the implementing capacity of the aspirants, which determines the marks in the exams. Okay, so yes, all important things we are covering here. Along with that, you people have to analyze the things what the examiner asking and how to give the response. Okay, and who all are scoring 50 to 60 marks, 50 to 60 marks in master nursing classes test series on the daily live exams. So please try to control your negative marks. Okay, so it's okay if 10 to 15 negative marks are coming, that is okay. Don't cross more than 15 negative marks. Okay, so that is how you have to take the calculated risk in your exams. Okay, so yes, if any one of you have any doubts on the negative marks control, I have given the a practically possible proof and practically possible strategy to control the negative marks. So I will give the video link in the description box at the end of this live class, so you can watch those video also for your future reference, right? So we'll start today's class without wasting the time. Yes, a very warm welcome everyone to once again to the master nursing classes. If anyone is new to the session, so please hit the like button Okay, and do subscribe to the channel that is giving you a high yield and very important content during your peak time of the preparation, right? Yes. The first question is, which of the following oxygen devices delivers the highest concentration of the oxygen? Okay, highest concentration of the oxygen. So what is your answer? Option A, the simple face mask. Bacho, in the yesterday's class, we have seen with the simple face mask, we can give maximum 60% of the oxygen concentration only. Okay, so here with other devices, we can give the 100% concentration. Okay, but with the simple face mask, we can deliver maximum 40 to 60% of the oxygen concentration only. So simple face mask is not a highest concentration oxygen delivery device. Okay, I'm eliminating. Then comes to the nasal cannula. Okay, from the nasal prongs or the nasal cannula, we can maximum delivery the 44% of the concentration only. Okay, so this is also not in highest concentration oxygen delivery system. Then comes to the Venturi mask. So even if I am keeping the 15 liter per minute of the flow rate, I have to only deliver, I am able to only deliver the 60% of the oxygen by the Venturi mask. Okay, so Venturi mask is also not an high concentration oxygen delivery system. So only one remaining, that is the non-rebreather mask. So from the non-rebreather mask, the flow rate we have to keep is the 10 to 15 liter per minute. Okay, some book given 8 to 15 liter per minute, that is also correct. Even you are giving only 10 liter per minute, okay, you can maintain the oxygen concentration between the 80 to 100%. Okay, so the non-rebreather mask is considered as the highest oxygen concentration device. The two term which will comes in your exam, so which will help you to choose the correct answer and give the best response. Okay, so one term yesterday I have said, that is the, yes, high flow and low concentration device, low concentration of the O2 device. So which device is which, even we are keeping the high flow and which is able to deliver only the low concentration of the oxygen. So which device that is? The answer is that is Venturi mask. Okay, that is your Venturi mask. Okay, just I told, even I am keeping the 15 liter per minute of the oxygen, means I am keeping the high flow oxygen, still I am able to deliver only 60% as a maximum concentration. So this is what we call as the high flow low concentration oxygen delivery system. Okay, and one more word which will come, that is the, yes, low flow high concentration. Low flow high concentration oxygen delivery system, that is our non-rebreather mask is the low flow, yes, non-rebreather mask. Okay, so this is the, we can maintain just low flow. Only I am giving the 10 liter per minute of the flow, then I am able to maintain 80 to 100% of the oxygen. So the question will become, the low flow high concentration is the non-rebreather mask and high flow low concentration is the Venturi mask. Okay, focus over the question and give the best response in your upcoming exams. It's most important, and highest concentration of the oxygen we can deliver by the oxygen delivery devices, that is the non-rebreather mask is the correct according to the option here. And this is the image based question which may comes directly in your exams on the non-rebreather mask. Okay, so this is what we call as the non-rebreather mask. Okay, sir, how we have to identify this is non-rebreather mask? Means bacho, here the patient is unable to rebreathe the air which he is exhaling. The meaning of the non-rebreather means, what I am exhaling it will go out and the outside air it will not come, and the exhaled carbon dioxide we won't able to inhale again. So that is, I am unable to rebreathe it. So I call this one is the non-rebreather mask. Sir, how it is possible? Look at me, not look at me. Okay, look at the image here. So this is the a pipe which we will connect to the oxygen source here. From here, the oxygen will come here, and here we are having one valve. Okay, so that valve, it is diverts the oxygen into this bag. Okay, so the bag is full now. The bag is full now with the oxygen, and here is the patient. When this patient inhales the oxygen, the complete oxygen which is there in the bag, it will goes to the patient at that time. So during the inhalation of the patient, okay, during the inhalation of the patient, the wall will get opens here. Okay, so wall will get opens here from the a reservoir bag. Okay, so the reservoir bag wall will open during the inhalation, and entire oxygen from the bag it will go to the patient. Okay, similarly, when the patient exhales the air, so that time during the exhalation, during the exhalation, this wall will get closes. Okay, this wall will get closes, so that time the patient CO2, what it will patient exhale, that will not go into the back because this wall will get closed. Okay, so there is no entry of the CO2 in the wall. One thing is clear, and one more wall we are having over the mask here. Are you people able to focus here? This particular wall. Okay, so this wall we can say the face mask wall. Okay, so there is the mask wall. This wall, what happens during the inhalation of the patient? During the inhalation of the patient, this particular wall it will get closes. So patient can only inhale the a pure oxygen from the bag. Okay, so during the inhalation, the mask wall will get closed. Okay. So during the exhalation, what I said, this wall will get closed means the patient exhaling the air. So that will go from this particular wall during the exhalation. It will get opens. Okay. It will get opens. So this is the mask wall which opens during the exhalation and close during the inhalation, and the bag reservoir bag wall so which opens during the inhalation and closes during the exhalation. This is how only the concentrated air it will go into the concentrated oxygen, it will go into the patient lung, and we are able to maintain the 100% of the oxygen. So that is the reason the non-rebreather mask is the oxygen delivery system where we can deliver the maximum concentration of the oxygen. So that is the non-rebreather mask. Okay, so remember, in mains exam there may be a chance of asking the question on this valve function. Okay, so the reservoir bag valve will opens during the inhalation and close during the exhalation, and the mask valve will get close during the inhalation and opens during the exhalation. Okay, this is the very very important point all you people have to remember and give best shot in your exam. And here is the important announcement for you people. So we are having a beautiful test series for our upcoming RRB exam, Norcet 8 exam, and all central government and state government exams, especially these two, RRB Nursing Superintendent exam and Norcet 8 AIMS Nursing Officer exam. So for the RRB Nursing Superintendent exam, we are having the beautiful plan as a Vande Bharat test series where we are giving the a same pattern exam with a high yield questions, updated questions, and important questions that is much necessary for the every aspirants to know and give the best answer in the exams. So which is included in the Vande Bharat test series exam. Okay, so for the Norcet 8, here we are giving the Norcet 8 booster test series as a live exams. Okay, where the examiner, where the student will feel the actual real exam. Okay, in the Norcet 8. Okay, if you want a both course separately means you can take separately. No sir, I am preparing both for Norcet 8 also and for RRB also means we are having the best shot, that is a sure selection test. So these two, Vande Bharat and Norcet 8, both will be given for the sure selection test series subscribers. If you want the best test series of the India with a highly quality content and a most updated content with a clear and simple rationale for everything, so you want means you just download our Master Nursing Classes app. The link and the link is given in the description box, and you want to join for our WhatsApp group, Telegram groups for the free quizzes and questions means you can join. I have given link both in the our Telegram our description box and in the comment box also. Okay, so yes, hope it's clear to everyone. And here is the next question. So which of the following is a typical flow rate ranges for the nasal cannula? For the nasal cannula, So this is the image based question of the nasal cannula. Okay, this is the image based question of the nasal cannula. So here we are having the nasal prongs and this is the nasal tubing. So this left side nasal prongs, it will go into the left nostril, and the right side nasal prongs, it will go into the right nostril. And this is the thing where we have to connect to the oxygen devices. Okay, so from here the patient will inhales the oxygen. Most important and very important, right? So here the chance of image based question is there. Okay, the question is here. So what is the typical flow rate ranges of the nasal cannula? Option A is there 1 to 4 liter, option B is there 6 to 10 liter, and option C is there 1 to 6 liter per minute, and option D is there 10 to 15 liter per minute. Bacho, if you are having both in option, that is the 1 to 4 minute liter per minute and 1 to 6 liter per minute means, so your best preference answer would be 1 to 6 liter per minute, because maximum we can deliver 6 liter per minute of the oxygen and minimum you can deliver 1 liter per minute of the oxygen. Okay, if this is not in the option, you can choose this one as a correct answer. Okay, but the best answer is there in the option. So my answer is the 1 to 6 liter per minute, and it delivers 24 percentage to the 44 percentage of the concentration of the oxygen. That is the nasal cannula. Okay, so nasal cannula is best method in a patient with anxiety. Okay, so where the patient can easily able to talk and share his feelings. So the preferred mode of delivering the oxygen in the patient with anxiety is the nasal cannula. And a patient who is a long term requirement of the oxygen, like a COPD cases, like where the continuous oxygen supply required to the some patients means, for the long term use you can use the best method as the nasal cannula. Okay, simple face mask we can't use for the long term because the patient won't unable to talk properly, unable to eat properly. Okay, so that is the long term use or not preferred one is the simple face mask. So best method of the oxygen delivery for the long term use is the, that is our nasal cannula. Two things is clear here. One is for the long term use and one is for the low concentration oxygen delivery, and one is for the anxiety patient. The best method is the nasal cannula. Okay, so the question will come, which is the best method of the delivering the oxygen in the COPD patient? Okay, so the first best answer is the blue color venturi mask. Okay, best method of the delivering the oxygen in the COPD patient is the blue color venturi mask. If in question they mentioned a best method of the oxygen delivery for the long term use, for the long term use means your best answer goes as the nasal cannula. Okay, so very important, because in the COPD patient maximum how much oxygen we can give in the COPD patient, a preferred dose of oxygen is only 1 to 2 liter per minute we can deliver. Okay, so here with the mask we are unable to deliver. Okay, why? Because in yesterday's class I told with the simple face mask at least 6 liter per minute we required. Okay, so at least 6 liter per minute we require. If doctor advised a 5 liter per minute, we are unable to use the simple face mask. 4 liter per minute, don't use the simple face mask. Okay, so we are not using for 5 liter, 4 liter and 3 to 1 liter means, so we are not using for the COPD patient. So which one useless oxygen delivery system in the COPD patient is the, that is the simple face mask. Okay, simple face mask is useful only if you want to deliver the oxygen more than 6 liter per minute. Okay, till the 10 liter per minute. Okay, 6 to 10 liter per minute if the prescribed oxygen rate of delivery is there means, then you people go for the simple face mask. Okay, simple face mask, that is the very important. If you want to deliver less than 6 liter per minute, the best method of the oxygen delivery is the, that is our nasal cannula. Okay, so it's a very important thing, all you people have to notice and give the best response here. Okay, so yes, let us revise the golden point chanting. Best in the COPD with chronic use, nasal cannula. Best in the COPD is the blue color venturi mask. The maximum oxygen delivery in the COPD best is the 1 to 2 liter per minute, and the most important oxygen device for the long term is the our nasal cannula. a best method of oxygen delivery in the patient with the anxiety is the nasal cannula. Okay, so these are the golden points what I have shared you people with the proof and best explanation. Okay, so hope it's clear to everyone. Okay, so here is the next question. Yes, so here is the next question. You people, please do focus over the question. It's already I have explained in the previous video. Okay, the preferred position during the insertion of the CVP line. Okay, so in the last class I have told during the monitoring of the central venous pressure, best one is the supine position with the head of the bed elevated 30 to 45 degree. So that is during the monitoring of the central venous pressure. So here the question is related to the, yes, during the insertion of the CVP, that is the central venous pressure. So which one is the best method of which one is the best position we have to give? Okay, already I have explained in that video only. So just to highlight the answer here, I have inserted this question. The correct answer is the Trundenberg position with the head turned to the opposite side. This is the proper perfect answer. You people have to choose during the insertion of the CVP, because this Trundenberg position where we are keeping the head down means the vein will get engorges, so we can easily insert the central venous catheter. One thing, and another best thing is the, so if accidentally air enters into the vein means it will get tappers here only. Okay, it will not go till pulmonary circulation. So that is the very very important two purpose of keeping the patient in the Trundenberg position for the easy access of the vein, and another one is to prevent the air embolism. Okay, so I have clear everything on this particular question. Okay, so I'm not going to waste much time because I already explained everything, right? So here is the next question. So very very important question for you people. Very very important, right? So the birth maneuver during the rapid sequence intubation, what it actually stands for? What is the meaning of the birth maneuver? Okay, so during the rapid sequence intubation, what is the rapid sequence intubation? Rapid sequence intubation is the insertion of the endotracheal tube in a trachea in emergency and very quickly. Okay, so patient is got emergency. Okay, where very quickly we need to insert the endotracheal tube. So that is what you call as in the rapid sequence intubation. During that we are doing one maneuver. The maneuver name is the burp maneuver. So what is the perfect full form of the burp technique? Okay, or burp maneuver. So the option is the backward, upward, and right pressure. So this is only the correct answer. Okay, so basic upper respiratory protocol is the wrong one. Bending under the rapid pressure is also wrong one, and breathe under rapid also wrong one. So the correct one is the burp is backward, upward, right pressure. So we are keeping the hand on the our thyroid and cricoid cartilage, where pushing is backward, upward, and right side. So why we have to do this particular burp technique? So why we have to do this particular burp technique? What is the purpose of doing the burp technique? This is the controversy question where many people have thought you people wrongly during the last after last Norcet exam. So believe me, what I am giving the answer which is the correct and final answer. Okay, so burp technique is done to visualize the vocal cord, to visualize the vocal cord easily. So that is the final and best answer for the burp technique. During the rapid sequence intubation, we need to insert the ET tube very fast. Means I am keeping the pressure over the my cricothyroid cartilage. Okay, so then the healthcare provider can easily visualize the this particular what we can say vocal cord, and he can easily insert the ET tube. Okay, this is the first priority answer. Okay, this is the first priority answer. Okay, if this one is not in use, you can go for the blockage of the esophagus and prevention of the aspiration. That is the second answer. Okay, during the intubation, to prevent the aspiration, so there is another maneuver is there. So the maneuver name is like this. Okay, that is Sellick maneuver. Okay, so this maneuver is performed during the Sellick maneuver. We can say this maneuver is performed during the intubation to prevent the aspiration. So the question is, which of the following is true about the Select maneuver? What is the following statement? Which of the following statement which is true about the Select maneuver? Option A, Select maneuver involves lifting the chin upward. No, the Select maneuver it not lifts the chin upward. So I am eliminating the option A. So then I am coming to the option B. That is the it is used to create clear view of the vocal cord. Yes. Then option C is telling that it applies the pressure on the cricoid cartilage to compress the esophagus. So this is the particular correct answer, that it applies the pressure on the cricoid cartilage to compress the esophagus. Okay, so this is the correct answer. So for clear view of the vocal cord, we are doing the burp technique or the burp maneuver. Okay, just now only I have told, so I'm eliminating the option B also. Okay, so here the Sellick maneuver, where we are putting the pressure on the cricoid cartilage. So this one is also called as the cricoid cartilage pressure during the intubation. So cricoid cartilage pressure I am maintaining means, yes, so that compresses the esophagus, and the reflex, if it is coming also, means it will not go into the trachea. So to prevent the aspiration, we are doing the Sellick maneuver. Okay, so clear bachcho, the Sellick maneuver is performed to prevent the aspiration during the intubation. One point, the burp technique is performed to visualize the vocal cord. Second point, no confusion, no more doubts, it's clear and it's final. Okay, give the best response like this only in your question, and get the best result in your upcoming exam. Okay, so here is the next question. What is the purpose of the Sellick maneuver? Okay, during the intubation, just now only we have discussed it, to prevent the aspiration by applying the cricoid pressure. Okay, by applying the cricoid pressure, so we are preventing the aspiration. So that is the main purpose of the Sellick maneuver during the intubation. Okay, so is it clear bacho? Yes, it's clear. Then comes to the a very important question again. Very important question, right? So the question is very simple. Which of the following is a key feature of the high flow nasal cannula? That is the HFNC. Many times the question came, what is the full form of the HFNC? The full form of the HFNC is high flow nasal cannula, is the full form of the HFNC. Okay, so which of the following is the key feature of the HFNC? Option A is telling it provides non-humidified oxygen. No bacho, we are providing the very high flow nasal oxygen, means the maximum we can deliver is the 40 liter per minute. We can deliver the oxygen with the high flow nasal cannula. Okay, so I am delivering the oxygen at the rate of the 40 liter per minute without humidifying. Without humidifying, I am delivering the oxygen, means so it will completely suddenly makes the airway to get dry, and there is chance of the damage to the airways also there. So this is not a key feature of the HFNC. I am eliminating the option A. Okay, so then comes to the option B. It delivers oxygen at a fixed flow rate. Bacho, to deliver the oxygen at the fixed flow rate. So in the yesterday's class, I have told you people, if you want to deliver oxygen in the fixed flow rate, or in a precise, or as accurate, you want to deliver, means choose the best oxygen delivery system. That is the Venturi mask is the, yes, that is the high flow low concentration device. That is the Venturi mask is used for the fixed flow rate delivery, or accurate delivery, or precise delivery. You want to maintain this, go for the fixed flow rate. That is the Venturi mask is the correct answer, not HFNC. So I'm eliminating option B also, right? Then comes to the option C. It delivers the heated and humidified oxygen at the high flow rate. So this is the correct answer. But here from the HFNC, as a key feature, we have to heat and humidify the oxygen and need to deliver at the high flow rate. Very importantly, HFNC is used for delivering the heated humidified oxygen at the very high flow rate. Okay, so it is very much correct answer. Okay, so option C. Then comes to the D. It is used to exclusively for intubated patient. No, for intubated patients we have to use for the ET tube. Okay, to deliver the oxygen we will use ET tube. And if the patient on the tracheostomy, we can use the tracheostomy tube. Okay, so no need for the HFNC. HFNC is the, yes, it's a non-invasive. We are not inserting anything inside the body. Externally only we are giving. Okay, so it's not useful in the intubated patient. So I'm eliminating the option D also. So the question will come as an image-based question in your upcoming Norcet on the HFNC. There is chance is there on the image-based questions on the HFNC. So please notice it. This is the high flow nasal cannula. Okay, so just previous question we have seen just a nasal cannula. Okay, so this is the nasal cannula. So here we are talking about the high flow nasal cannula. Both are looks the same, but this is the like a big pipe is there, that one is the small pipe. Okay, you can identify it very easily. The structure is also different. Okay, so this is how they can give in the exam. Okay, so this is both are the high flow nasal cannula. So yes, can we do golden point chanting on the high flow nasal cannula? HFNC. Bacho, I told you people that yes, don't worry, my face is my video is coming black because of this some camera issue. Okay, so yes, the light problem is there in the studio. So please stay focused over the board. Okay, don't focus over me, right? So we'll not stop the class. We'll continue the class, right? So HFNC is this image based question. What we are studying here is the high flow nasal cannula. Okay, so as I told, it is delivering heated and humidified humidified air. So this humidified air means we can say this one as in the moist air. Okay, so we are delivering at the rate of the 40 liter per minute. So 40 liter per minute of the moist air we are delivering means the entire respiratory system become moist. Okay, entire respiratory system become moist. So it increases the highest risk of the infection. Okay, highest risk of the infection there with which oxygen delivery system, the highest risk of the infection is there with the HFNC because of the highly humidified and high rate of the oxygen supply. So this question may strikes in your exam. Which of the following oxygen delivery system is having the highest risk of the respiratory infection? So the HFNC is having the highest risk of the, yes, respiratory infection. Very important. Okay, so yes, it's clear. I think the flow rate also they can ask. The minimum we can deliver the 8 liter per minute to the 40 liter per minute is the flow rate for the HFNC, and we can meet the 100 percentage of the 100 percentage of the oxygen concentration we can meet with this one. Okay, so with the help of the HFNC, right? So this is the clear and everything points on the HFNC which will strike in your upcoming exam. So here is the next question for you people. So please do read the question completely. Okay, so then we will go for the answers. Okay, so which or what is the one of the main advantage of using the non-invasive ventilation? The NIV stands here is the NIV stands here is the that is the non-invasive ventilation. So what it means, sir? What is the meaning of this one, sir? It is non-invasive means the word invasive means we are something putting inside the body. So it is non-invasive means externally by using the a big mask, the airtight seal mask, we are delivering the positive pressure ventilation. So that is what you call as the without any invasive means without any tracheostomy tube, without any EG tube, we are delivering the positive pressure ventilation by using the a tight air seal mask. So that is what you call as the non-invasive ventilator mask. Okay, that is what you call as the NIV mask. Okay, we can call this one as the BiPAP mask or CPAP mask also. Okay, so what is which one of the following is the main advantage of using the NIV mask as compared to the invasive mechanical ventilator? So option A is telling it requires the surgical procedure. Bacho, only invasive mechanical ventilator where we are going for the tracheostomy tube, so there it requires the surgical procedure. For NIV I told it's a non-invasive, we are not putting anything inside the body, so there is no need of the surgical incision. So it's not an advantage of the NIV. Okay, so I am eliminating option A. Then comes to the option B. It eliminates the need of the sedation. Yes, but if I am keeping any tube, that is the ET tube in the patient and tracheostomy tube in the patient, if I'm placing the patient on the mechanical ventilator, means I have to give the sedation to the patient. Otherwise, the patient will try for a spontaneous breathing. Okay, the patient is trying to exhale the air out, and the mechanical ventilator, which is forcefully pushing the air in, means there is chance of the barotrauma. Means because of the increased pressure in the thorax, there is damage to the alveoli. Because of the increased pressure in the thorax, it damages the alveoli. That is what we call as the barotrauma. That what we call that one as in the barotrauma, right? So barotrauma is the barometer. What is the barometer? Barometer is the pressure monitoring meter. We call as the barometer because of the increased pressure. Okay, so that time the damage to the alveolus are happening. That is what we call as the barotrauma. It's a complication of the mechanical ventilator. Okay, when the patient is trying to exhale and ventilator is pushing the air inside. So in order to avoid this one, we need to give the sedation to the patient where the ventilator will regulate both inhalation and exhalation of the patient. Okay, so that is the very clear to you, or I think so. Okay, yes, it eliminates the need for the sedation. Okay, so this is the advantage of our this one NIV. Okay, so in the non-invasive ventilation where we are keeping a just mask like this. Okay, so this is what you call as the NIV mask, or we can say this one as in the BiPAP mask, or we can say this one is in the CPAP mask. The mask is same for all things. Okay, it may be a BiPAP mask, CPAP mask, NIV mask. So the devices will different. Okay, this one is the CPAP device. Okay, this is the CPAP, or we can say BiPAP device, where it is continuously producing the air and which is continuously pushing inside, and it maintains the positive pressure ventilation. Okay, so and it positive pressure ventilation helps to maintain the PEEP, that is the positive and expiratory pressure. Okay, what is the normal PEEP? Okay, what is the normal PEEP value? The normal PEEP required. What is the PEEP? PEEP is the positive and expiratory pressure. Yes, at the end of the expiration, how much pressure, how much positive pressure which is required in our alveoli. That is the PEEP. Okay, at the end of the expiration, at least 5 mm of Hg to 8 mm of Hg pressure should be there in our alveoli, so that alveoli will not collapse. So there is less pressure at the alveolar level, means the PEEP is not maintaining, means the alveoli will get collapses. Okay, so that is the very important thing here. So PEEP 5 mm of Hg to 8 mm of Hg. Here we have to maintain the PEEP this much in order to prevent the alveolar collapse. The question will come, why we have to maintain the positive pressure ventilation in order to prevent the alveolar collapse? Why we have to maintain the PEEP? Again, the answer, in order to prevent the alveolar collapse. Okay, what is the purpose of the continuous positive airway pressure and bi-level positive airway pressure? Again, the same answer, in order to prevent the alveolar collapse and in order to maintain the pressure at the alveoli. So that is the purpose of the CPAP, BiPAP, PEEP and positive pressure ventilation. Okay, so this image based questions may strikes in your exam. This is the mask where we are using for the NIV. Okay, without any invasive procedure, we are giving the this PEEP, positive pressure ventilation, everything. Okay, so that is the very important for you people. Okay, and while using the NIV, there is no need of the sedation. So while using the mechanical ventilator, it is required of the sedation. So this is the advantage we are having. So there is no need of the sedation. Okay, so very important. And option C is telling it provides the more oxygen concentration. Okay, accurately. Yes, more than this, mechanical ventilator will provide the best oxygen accurately. Okay, but as compared to the NIV mask, mechanical ventilator won't provide the mechanical ventilator will provide the better oxygen as compared to the NIV. So this is not an advantage. So then option D, it can be used in all emergency situation. For the emergency situation, best one is the invasive, that is the endotracheal tube and tracheostomy tube. So we can use for the emergency as compared to the CPAP and BiPAP. Okay, so that is the very important, right? So the question answer here, option B, it eliminates the need for sedation, means in the NIV we know there is no need to maintain of the sedation. Okay, that is the extra benefit we are having. Okay, so this is the how NIV ventilation works. Okay, that is the non-invasive ventilation. So here this is the ventilator machine and this is the circuit, that's we can say the brain circuit, which is connected to the our BiPAP mask or the CPAP mask or the NIV mask. Okay, so it externally only providing the high pressure oxygen, so it will go into the patient body. Okay, there is no need of the any invasive procedure like intubation and tracheostomy too. Okay, so it's clear, I think so, hope, right? So here is the next question. The next question is very simple. What type of wound is most likely benefits from the an oxygen tent? With the help of the oxygen tent, which type of the wounds most likely helps? Students, we are having the hyperbaric oxygen therapy. Hyperbaric oxygen therapy. Here, in a particular tent, or in a particular chamber, we are creating the very high pressure. Just I told baric or baro means pressure. Okay, so that is the hyperbaric means with high pressure we are giving the oxygen. Okay, so consider this is the leg of the patient. Okay, and here the patient is having the wound, and for this wound the blood supply is interrupted. Okay, so for this wound the blood supply should be normal. Okay, then only this wound will get healed. Okay, for healing the oxygen is must required, so for that blood supply is must required, but this wound is interrupted because of the chronic ulcer, because of the diabetic ulcer, because of the pressure ulcer. Okay, this area the blood supply is interrupted, the blood supply is decreased, so at that time we have to deliver and give the oxygen externally with the help of the hyperbaric oxygen therapy in order to heal this particular pressure ulcer, chronic ulcers, and like diabetic foot ulcers. So and large wounds also we need to promote the healing by giving the yes oxygen through the tent in a hyperbaric oxygen chambers. Okay, so this is the helpful in the large deep chronic wounds and such as diabetic ulcers and pressure sores, where we have to deliver the oxygen externally in a chamber like this. Okay, so this is the yes our hyperbaric oxygen therapy chamber, or we can say this one as in the oxygen tent also. Okay, so this one is very old one. So in a nowadays there is another different chambers which are ready-made chambers came, where we will put the patients inside the chambers and we will give the continuous high pressure oxygen, that is for the oxygen hyperbaric oxygen therapy. Okay, so for this one we can say this is as perfectly as a oxygen tent, where we are giving the oxygen tent. Okay, so in burns patient also we will give the oxygen tent in order to promote the wound healing, and in a patient with facial injury and a nasal injury, where we are unable to deliver the oxygen with a nasal cannula and mask, so we can go for the oxygen tent, and entire body oxygen is required, then we can go for the oxygen tent, and for the wound healing also it promotes. Okay, so the next question is this one. Yes, the very simple and very important question. So which of the following patient is most likely to get benefit from the use of the an oxygen hood? So the best mode of delivery of the oxygen, in which particular age group we are using the oxygen hood? Yes, option A is telling a patient with a chronic obstructive pulmonary disease. Bacho, just I have told in the previous class video only, for the COPD, the best one is the yes, a blue color Venturi mask, and for the COPD with the chronic use of the oxygen, the best one is the nasal cannula. So the oxygen hood is not used in the COPD patient, and I am eliminating the option A here. Then comes to the option B, a premature infant requiring the oxygen therapy. Yes, the best method of delivering the oxygen in a premature infants or the newborn and infants. Okay, so in a newborn infants you want to deliver the oxygen perfectly means, so the best method of delivering the oxygen is the oxygen hood, and this is the image based questions that may strikes in your upcoming exams. on the oxygen hood. Okay, look at this one. This is the oxygen hood, and from here we are here is the oxygen source which is coming continuously, and the child will inhale this oxygen. Okay, it will go into the lungs of the child. Okay, so this is what we call as the oxygen hood. Very very importantly used in a, yes, infants and neonates. The best method of oxygen delivery in the infants and neonates. That is the correct answer here, right? So hope the concept is clear here, and option B is the correct answer for this particular question, right? So here is the next question for you people. Anything left in the last question? Let me check, please. Yes, nothing is there. So go for the next question, right? So here is the next important question on the a complication of the oxygen delivery. That is the retrolental fibroplasia. So please do choose the best answer based on your knowledge and apply your knowledge here. That is very much helpful for everyone to get the correct answer in the main exams. Okay, it's a very simple concept. The ROP here is the retinopathy of the prematurity, or we can say the retrolental fibroplasia. So, which of the following is a key factor in the prevention of the retrolental fibroplasia? Okay, why it happens actually? Why it happens actually? So, the retrolental fibroplasia, it happens because of the O2 toxicity. Okay, so there is ototoxicity means there is increased risk of the retrolental fibroplasia. So we can say this one is in the retinopathy of the prematurity also. Okay, so here because of the excessive oxygen delivery, so it may leads to the hyperoxia. Okay, means excessive oxygen overload. So that may leads to the, yes, the retrolental fibroplasia or the retinopathy of the prematurity. So the question is asking the key factor to prevent that one. Okay, how to prevent this one? So the what I told, the cause is oxygen toxicity. Because of the excessive administration of the oxygen, it happens. So the prevention is to reduce the oxygen in premature infants to avoid the hyperoxia. Okay, so hyperoxia means excessive oxygen level at the tissue. Okay, that is what we call as the hyperoxia. Hyperoxemia means excessive oxygen level in the blood. That is the hyperoxemia. Then hyperoxia means excessive oxygen in the tissue. That is the hyperoxia. Okay, so to prevent the hyperoxia, we need to reduce the oxygen therapy in premature infants. Okay, the premature infants are highest risk of the damage to their lens and retina. Okay, so most importantly, in order to prevent the retrolental fibroplasia or the prematurity, retinopathy of the prematurity, so we have to don't make the baby overload with oxygen. Okay, reduce the oxygen therapy. Okay, that is the correct answer here. Okay, so hope the concept is clear for everyone. Then comes to the next important question, that is here. What is the primary risk associated with hyperbaric oxygen therapy? But as I told, there will be a specific chamber where we will be inserting the patient inside, and we are giving the oxygen with high pressure. Oxygen with high pressure. Why we are giving this one? We are giving to promote the healing. Okay, we are giving to promote the healing. So wherever I am using the hyperbaric oxygen therapy means, so I can use this one in the bone healing. Okay, so in the bone healing like osteomyelitis, where there is an infection, inflammation, and wound in the bone and bone marrow. That is what we call as the osteomyelitis. So there I can use the hyperbaric oxygen therapy. And similarly, I have told in the pressure ulcer healing, and in the burns scar healing, and in the burns wound healing, and most importantly in the, yes, ulcer which is created by the a chronic wound. Okay, and a diabetic foot, there where we are externally forcefully we are introducing the oxygen. Okay, that is creating the hyperbaric oxygen therapy. So in osteomyelitis case also, okay, and diabetic foot also, in the diabetic foot, so we can use the, yes, we can use the hyperbaric oxygen therapy. And chronic unhealed wound, so use the hyperbaric oxygen therapy. And in the pressure ulcer, use the hyperbaric oxygen therapy. So it's an hyperbaric means high pressure O2 I am giving. So Usually O2 isn't flammable. Usually O2 isn't flammable. What is the meaning of the flammable? It supports the fire. Okay, so there is small fire is there. So beside of that, you keep the concentrated O2, that fire becomes suddenly big. Okay, so here we are giving the chamber, and in chamber highly pressured oxygen is there. So the primary risk of the this particular thing may be a fire, and explosive hazards may happen in the hospitals because of the some negligences where some patients used to use the matrices. You know that people used to use for the cigarette smoking. So that kind of the things they may use, and some flammable agents like alcohol. Okay, alcohol also supports the fire. I think you people know that one. Okay, like there's some flammable agents we are using at the this hyperbaric oxygen therapy, and there is a small fire point. Okay, so if that exits the fire means that leads to the entire ward blast with the this particular thing. So we have to avoid the fire and fire supporting things near the oxygen hyperbaric oxygen therapy, because it's very very dangerous. If in case fire happened in the hospital, consider, so then we have to go for one protocol, that is the race protocol. Okay, what is that? The race protocol. So read this question completely. Okay, then choose your correct and best answer. Right, so students, don't focus over my picture here. Yes, as I told, some camera problem is there, so we will correct it in next session. So I'm the content quality and other thing have not compromised, so I'm delivering the same content, same quality. Okay, so please focus over the slides. Okay, and board also. Right, yes. In the race protocol, what does R stands for? What is the meaning of the R? Okay, what is the meaning of the R in the race protocol? Right. So option A, that is the rescue the patient or individuals from the immediate danger. Okay, so option A, R stands here as the rescue the patient or the individuals from the immediate dangers. Option B is there, remove the fire source. Option C is there, review the unconscious individual. So option D is the report the fire to the emergency services. So what is the R stands here in the yes race protocol? Very nice of you all. So here the first priority thing we have to do when there is a fire in the hospital, that is the we have to take out the all the patients from the particular source, and we have to shift the patient to the safe place. So that is the very very important and first priority. Okay, so many of you will think that, sir, the oxygen source is also on, then the fire also started, which one we have to do first, sir? Whether we have to make the oxygen switch off, or whether we have to move the patient from the particular what we can say, from the particular ward to out of the ward. So first, according to protocol, if they are asking, yes, race protocol means first we have to rescue the patient according to protocol, move all the patient from the ward to the out of the ward. Okay, so that is the very very important and the first priority people have to give here. Okay, so yes, here is the race protocol. Look at this one. So the fire in the healthcare settings happen means, so we have to take the fire safety. Very very important, very very important for you people. Okay, let me quickly revise this thing. Okay, so here R stands here, rescue the patient. Okay, what nursing officer is doing here, he is making the patient to moving out of the ward, so we are rescuing the patient. Then A stands here is the yes, activate the alarm and inform the all the emergency team where the fire is setting happened, and we need to inform the proper place and the type of the fire, whether it is an electrical fire or whether it may be an another type of the fire. So we need to inform that one also, and especially point of the fire we have to inform, whether it may be in first floor, second floor, casualty, ICU, NICU, IPD, where it is actually fire happened. Because if you are not specifying the point means where the emergency response team will come. So immediately you have to activate the alarm and you have to inform that this is the point where the fire happened and the type of the fire, that is the electrical fire which happened. So you have to say like that. Okay, in the activation of the alarm. Then comes to the option next C. C stands here the try to confine or contain the fire. Means if the fire is in the one ward, so Fatapat do close that particular ward. Okay, so close all windows, close all doors where the fire will not come out. Okay, so that is very important. So by fire we have to contain and confine by closing the doors and windows. Okay, that is the third one. So how we have to confine the fire? By closing the doors and windows of the particular ward or the casualty and emergency room. Okay, so then comes to the E stands here as the use of the extinguisher. Okay, extinguisher means it is a red color cylinder with carbon dioxide loaded. Don't confuse bacho. A extinguisher color is red in color and which is loaded by the carbon dioxide, and the like the cylinder which we are using for the storing the carbon dioxide for the medical use is the that is the gray color cylinder. Okay, so carbon dioxide loaded cylinder, that is the gray color cylinder. Okay, in the extinguisher which is the red color cylinder, I think all you people have seen that extinguishers where the small red color cylinders they have attached to the walls of the hospitals. Okay, those are called as the extinguisher. So there is one technique to use the extinguisher, that is the fast technique. Okay, what is that? That is the fast technique. How we have to use the extinguisher. Okay, how to properly operate the extinguishers. So that is the very important. First is the P means we have to pull the chain which is there here. Okay, so extinguisher is locked by one small pin. Okay, we have to pull that pin out. Okay, so if I pull that pin out, so the extinguisher is now ready to use. Then aim at the base of the fire. Okay, consider this is the fire. Let me make a fire. Okay, this is the fire and this one is the base of the fire. So extinguisher we have to face and focus over the this particular base of the fire. Okay, focus the extinguisher on the base of the fire. Okay, that is the aim the extinguisher at the base of the fire. Then push sorry, this S stands here as a squeeze. Okay, we have to squeeze the handle. Okay, then the extinguisher, the particular stored air will come out, then sweep. Okay, so you have to sweep by side to side like this. Okay, this is the how the pass stands here. The examiner may throw the answer from here also. P stands here as the pull the pin, S stands here as the aim the base of the fire, S stands here as the squeeze the handles, and S stands here as the sweep the particular fire extinguisher where the it will reduces the our fires. Okay, so that is very important. And we have left with one more image, that is the Wolfian bottle. Wolfian bottle we can say, or we can say the oxygen humidifier. Oxygen humidifier. Okay, so this particular device is known as the oxygen humidifier or the Wolfian bottle. Okay, so here in this particular bottle we need to add the water. So the oxygen which is coming here, it will come first down, then it will move on through the water, so it will get humidified, then it will go to the patient. Okay, so it will go to the patient, so we are delivering the humidified oxygen with the help of this bottle. So this is what we call as the Wolfian bottle or the oxygen humidifier. Very important. And this is the flow meter where the numbering will be there. Okay, so if this particular ball is here means, so that number is here means we are delivering the 4 liter per minute. Okay, so very importantly. And this is the pressure gauge. It will show how much pressure will be there in the oxygen cylinder. So remember bacho, the normal pressure which will be there in the oxygen cylinder is the 2200 psi. Okay, so this will be pressure which will be there in the oxygen cylinder. Okay, remember the pressure in the oxygen cylinder is the 2200 psi is the pressure which is there in the oxygen cylinder. Most important and all rapid revision points on this particular we have discussed here, right? So here is the next question: why the humidification is necessary for the oxygen delivery system? Yes, humidification is necessary for the oxygen delivery system to prevent the drying of the nasal mucosa and to prevent the rupture of the nasal mucosa. We have to send the humidified oxygen. That is the most important. Okay, and as a nursing officer, are you able to independently deliver the oxygen or not? Yes, you are having the rights to deliver the oxygen independently. That is the less than 2 liter per minute you can give the independent oxygen in the emergency situations. Okay, so this is the very important point you have to notice here. Okay, so then comes to the next question: Yes, please do read the question properly, completely till the end, and give your best response in the comment box. I'm waiting for your answers in the comment box. Fatafa do response to the question. Okay. So, what is the most common complication of the inserting the nasopharyngeal airway? Okay. So, this is the nasopharyngeal airway. So, where we are inserting this one into the nose of the patient. So, what is the most common complication of inserting the nasopharyngeal airway? So, option A, damaging the esophagus. So we are not inserting the nasopharyngeal airway in the esophagus. I am eliminating the option A. This is not a correct answer. Then option D. Oh, it's the option is there. Answer is there in the question only. Okay. So look at this one. The answer is there is the trauma to the nasal passages or the nasal bleeding. So that is the it may create the trauma to the nasal passages or the nasal bleedings. This is the most common complication of the our nasopharyngeal airway, and where we have to insert the nasopharyngeal airway preferably right nostril or the left nostril, where we have to insert, we are having the two holes over the nose, so that is called as the nostril holes. Okay, so which side is preferred one? Yes, the left side is the preferred one, so we have to insert the nasopharyngeal airway preferably left side, because some deviation is there normally in the right side. Okay, so in order to prevent that one, so left side we have to insert the this one nasopharyngeal airway preferably. Okay, the question will come, how to measure the nasopharyngeal airway? So you have to measure the size of the nasopharyngeal airway. Okay, by yes, holding this nasopharyngeal airway at the bridge of the nose to the tragus of the ear. Okay, how we have to measure this one? Yes, make a note of this one. How we have to measure the length of the nasopharyngeal airway? You can measure by tip of nose to the tragus of the ear. This is how you have to measure the length of the nasopharyngeal airway. Very important. And left side is the preferably we will insert. Okay, so which will causes the maximum most commonly causing the damage to the our nasal pharynx passages. So this one is least commonly used now. Okay, it is used least commonly now in the hospital settings. Okay, instead of this one we have replaced with the nasal cannulas. Okay, so nasal cannulas we are using, and this is the preferred one, and we are using it now in the hospital settings, and very least commonly we are using the nasopharyngeal airways. Okay, so the next question is here. Yes, what is the primary purpose of the godal airway or the oropharyngeal airway? Yes, already we have discussed the image based question on the godal airway or the oropharyngeal airway. Just know the why we have to use this one means, yes, we have to use this one. The primary purpose is to secure the airway in the unconscious patient and prevent the tongue fall back. Okay, so main purpose is the, yes, the godal airway or the oropharyngeal airway. Yes, almost all people given the correct answer, to secure the airway in the unconscious patient. But so what happens when the patient is completely unconscious and the patient will go into the coma? That time the patient's own tongue will go and fall back on the trachea and our what we can say vocal cord. Our tongue itself, it will cause the blockage, and there may be a chance of the respiratory blockage. So in order to prevent that one, we have to insert our godal airway or the oropharyngeal airway. So first primary purpose of this particular airway is to prevent tongue fall back. Okay, so to prevent the tongue fall back, we have to use this one, and we have to use this one in the intubated patient also, in order to prevent the tongue bite. Sorry, in order to prevent the bite of the UT tube. Okay, we can use this one to prevent bite of ET tube. So, as I told, when we will insert the ET tube to the patient, so we have to keep the patient sedated. Okay, so if the patient sedation is over and the patient is gradually coming to the consciousness, means the patient will bite the ET tube. Okay, so and the biting of the ET tube will blocks the airway. Okay, in order to prevent that one, again we are using this particular godal airway or the oropharyngeal airway. It prevents the bite of the ET tube also, and teeth should be comes on this color coding. Okay, so if the patient trying to bite also, it won't able to bite the ET tube, so there is no any airway blockage. But the primary purpose is to prevent the tongue fallback. We are using the this particular godal airway. So we have discussed the most of the important questions points in the today's session, that is related to the oxygen delivery system. most important and high yield concept and points I have discussed in clear. Okay, so in the next session again I will come with a very important questions and concept. Okay, so as I told, you are a nursing officer or the nursing students preparing for the RRB exam and Norcet 8 exams. You want a best quality test series in a very affordable price in India. Means please do choose the master nursing classes where we are revising the every question before living in front of you people with the highly updated content. We are delivering the a complete best test series for the Indian students. Okay, yes, I think it's clear for you all. Okay, if you want to be a part of the RRB test series, go for the Vande Bharat test series. If you want to be a part of the Norcet 8 test series, then go for the Norcet 8 booster test series. And if you want to become a part of the Sure Selection test series, that is including the both Norcet 8 and RRB preparation, so you can join this test series also. It's very important. I have given the link in the description box for the downloading the Master Nursing Classes app, where you people will get the freely also some content like updated national immunization schedule and all. So we have kept in the free content. Okay, so there is free content also there. You can download the Master Nursing Classes app and you can use the that particular notes as a rapid revision. Okay, so some mnemonics also we have added in our app. Okay, recently you can use that one also. So to use that one, you have to click over the free content, then scroll down. There are the PDFs are there, so you can use that one also for your further reference and the best reference. Okay, so yes, I hope that today's class is very much helpful for you all. If anyone of you are watching the video first time from the master nursing classes, so please do subscribe to the channel and hit the like button, so that may helps us and helps you to promote the next video also, and the next video also it will come in front of you people. Okay, yes, and if you want to part of our free Telegram quiz, you can join the Telegram quiz also. I have given the link in the comment box and the description box both. Okay. So if you found this video helpful, so please do thumbs up in the our comment box. We'll meet again in the next class. तब तक के लिए जय हिंद, जय भारत. कुछ भी होने दो, रुकना नहीं, थकना नहीं, झुकना नहीं. So practice to be a continued till a last minute of the exam, and the preparation to be a continued till the last minute of the exam to give the best shot in the upcoming Norcet 8 and RRB exams. We'll meet again in the tomorrow session again. तब तक के लिए जय हिंद, जय भारत.